Right now at 5:30, with countless spring breakers expected to flock to and from Northeast Florida in just a matter of days, health officials are sounding the alarm about the measles.
It will spread. The issue is not if measles will spread, it's how significant the spread will be.
As of now, there are no confirmed measles cases in Duval County, but doctors worry that could change with spring break starting next week.
In fact, the city put out a warning earlier in the week saying once a person is infected with the virus, they can spread it to 9 out of 10 unvaccinated contacts. So far, 10 cases have been reported in Florida, 9 in Broward, and 1 in Polk County. News for Jax reporter Ashley Harding spoke to a pediatrician and a man who survived the measles about why it's important to be vaccinated.
Garcia is 44 years old now, but he'll never forget having the measles when he was in high school.
You remember pain. One thing you don't ever forget, you remember pain in anything, so you remember the things that hurt you the most.
High fever, red, watery eyes, a rash on the face and neck. Garcia remembers it all too well.
It made me real weak. It probably took me about maybe about a week and a half or 2 weeks to start feeling normal again. I had to miss 2 weeks of school.
With several of our local counties already on spring break and Duval students starting spring break Monday, doctors are concerned we could see cases pop up locally.
We've already had a number of children across the state that have been infected. We should expect infections here in Duval County.
Dr. Jeffrey Goldhagen is a local pediatrician and says that's why it's important to make sure your kids are vaccinated. He says for there to be herd immunity, more than 95% of children need to be vaccinated.
Have you seen resistance from some parents over the years with the measles vaccine?
We've always had a concern by some parents about vaccinating against measles and measles, mumps, and rubella, but we've generally in the past been able to maintain a 95% plus vaccination rate.
Dr. Goldhagen says post-COVID, that number has dropped to 90% or less. And according to Partnership for Child Health, about 1 in 5 unvaccinated children who get the measles will become hospitalized.
Obviously, once Duval County's spring break starts, we could expect to see even more people here out on the beach. But health officials, one of the main reasons they're concerned is because measles can lead to other more serious issues. Pneumonia is a big one. Encephalitis is also a possibility. That's a swelling of the brain. It can lead to convulsions, deafness, or even leave a child with an intellectual disability.
As families finalize their trips and travel plans, they and others hope that families will take this seriously.
Knowing that you had it, how hopeful are you that parents will hear the message?
Oh, I'm pretty hopeful that I know a lot of times parents they want the best for their children, especially even myself. So I would definitely make sure everybody has their vaccinations and stay away from the places where the contagion can happen.
Information to help families stay healthy as they enjoy spring break in Florida and beyond. Ashley Harding, Channel 4, the local station.